Hi, I'd like to talk about Hyperemesis Gravidarum treatment here at Antai Hospital and why we stress about the comprehensive treatment for this specific and also very complex condition. Now, why does hyperemesis need a comprehensive treatment is that although we do have our HCG desensitizer that is very effective in dealing with hyperemesis, dealing with the root cause, neutralizing it so that you don't even develop it during pregnancy. But that being said, this is treatment received before any type of pregnancy. But in most cases, we don't really get these types of patients. In most cases, our patients are already pregnant and it's their first time having hyperemesis. And it's so severe, and at the same time, they're trying to carry a pregnancy at the same time. So it is a much more complex situation now, and this type of patient needs a comprehensive treatment. So hyperemesis has the potential to trigger or aggravate pre-existing conditions or trigger complications. So you won't see hyperemesis being a standalone cause behind his patient's suffering. Usually it will have some other type of condition at the same time caused by this hyperemesis. So let's talk about that. So for example, pre-existing condition. For example, this patient has some mild form of depression before pregnancy that she is unaware of. Some other pre-existing conditions, for example, diabetes, heart disease, all of which are very mild. Even hypertension, all of which are very mild. But during pregnancy, Hyperemesis gravidarum is able to greatly aggravate and trigger this pre-existing condition to much more severe levels. So when we look at diagnosis and treatment, we need to treat not only her Hyperemesis gravidarum, we also need to treat her pre-existing conditions, if any. Then only we can see the patient recover and actually have her symptoms alleviated so that she can actually start eating and sleeping again. Otherwise, if we only treat Hyperemesis gravidarum, these pre-existing conditions continue to wreak havoc, give her suffering. She's unable to recover at all. And potentially, if you don't deal with it, it may lead to a pregnancy loss, which is something that we don't want to happen. Secondly is complications, which means hyperemesis is triggering something. For example, the most common one that we see is hyperthyroidism or hypothyroidism. So we need to know how to recognize these things. We can't just solely treat the root cause. We also need to treat these existing conditions or complications. So the most common one we see is hyperthyroidism and hypothyroidism. There are others as well, but you get the idea is that Hyperemesis gravidarum is a condition that requires comprehensive treatment. That is the only way that you can see full recovery, especially during difficult times such as in the midst of pregnancy. So here at Antai Hospital, with our years of experience with dealing with hyperemesis, this is one of our greatest conclusions, and it has helped us benefit several patients, several hundred patients who have come receive treatment with us. We offer you a full contractual treatment with full refund guarantee if you do not recover from our treatment. If you'd like to find out more information about hyperemesis, or if you'd like to receive treatment with us today, please get in touch via the website and also leave a comment down below.